It's 9 o'clock. It's time for living. And this morning, I get to be the presenter in living, thanks to the doc. Today it's Heart Talk, all about the heart experience. And we have David Drakes with us, Patricia Corbin is with us, and they have got some deep and interesting heart experiences to share with us. And these experiences are connected very closely to what we call living. Don't think it's possible to be living without a heart experience, but some experiences are deeper than others. So we look forward to hearing from David and Patricia during the next half an hour in Living here on Voice of Barbados. The heart experience. Stay with us. Okay, so welcome to Studio 1. David Drakes, Patricia Corbin. How do you do today? You're doing fine.
Yeah.
How is the heart today?
Pretty okay.
Pretty I understand you've been talking a lot about the heart recently. Now, it's proper to hear from the lady first, Patricia Corbin. I notice since you came into this studio, you seem very familiar with what goes on in here and what we put out. You're a VOB fan?
Sort of.
Sort of. Okay. How long have you been a VOB fan?
Quite a few years now.
It's good for your heart?
Yes. That was even Radio Fusion.
Back in the Radio Fusion days?
Yes.
Okay. Yeah. I think that must be good for your heart.
Yes.
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 Yes. But would you say that you are a heart patient?
I could probably say so. Yes.
Okay. Why would you say that?
Because I've been having little bouts of things with the heart.
Yes.
Okay.
For how long now?
Probably back in the 19s.
Mm-hmm.
But in 2001.
Yes.
I think it's 2001 or 2002, somewhere around there. I had to get an angiogram done.
What is that?
This is a procedure where they do the ink.
Yeah.
They
do something with ink?
Yeah, fluid into the heart.
Right.
To see if there are any blockages or anything.
Right, okay.
And then I had the angioplasty done after that.
Okay, so what's that?
And that is where they put in a stent and a balloon.
Okay.
And from there on I was sending...
The only balloon that I know about is the one you blow out. Is it similar?
I don't think so, because
but what does it do? What does it do?
It opens up the valves.
Right, yes, yes.
So that you can put in the stent.
Okay, and then what does that stent do?
It just...
It fixes the problem?
Open, yes.
Okay.
Yes,
okay. So
you have clear fluid.
Okay. And then you feel better.
Yes.
And you stand a better chance of living and enjoying life more. Okay. Okay. I'm going to come back to you, Patricia. Okay. David, does that description, that information from Patricia, does that match with your experience?
Yeah, to a large extent. I had heart disease. Well, it's a continual process. So
right.
Managing it. But it was there were a number of blockages. I had 3 blockages originally.
Okay.
And Dr. Sparman did all the preliminary work in terms of the doing the same angiogram process.
Yes. Checking for blockages.
It was discovered that there were 3 blockages.
Right.
Actually, I've been on both sides of the fence. We have had the angioplasty then.
Yes.
In addition to triple bypass as well.
Triple bypass. Yeah. I often wonder about this bypass thing. Some people have 1 bypass, some 2, some 3. I mean, what is a bypass?
It is really where you have more than 1 blockage.
Yes.
You have 3
and
blockages.
you have to bypass that blockage.
Yeah, you have to actually.
It's like you run another you run another pipe, run another tube, pass that.
It's actually taking a blood vessel of your hand or your leg.
Yes.
Or some other part of your
one that doesn't have a blockage.
And attach it.
And attach it to a part that is good, and then go past the part that is bad, and attach it to another part that is good.
Yes.
Remarkable.
Yeah, and then I also subsequent to that then had the angioplasty then.
Yes.
Again.
That's the one with the balloon?
Balloon. and the stick.
And the stick.
And, you know, I had all two processes so I can make the comparison. As far as I'm concerned, there's need for both.
Now, when I talk to Patricia, she mentions 2001.
Mine was 2002.
2002, 1 year later.
2002 for the bypass and 2011 for having the angioplasty in the stick.
Yes. But how did you feel before 2002 then? Tell me the difference between the life that you were living before 2002 and then the life that you've been living since you had the procedure.
Well, actually, I've always been trained to keep relatively fit because there are the normal illnesses that I've acquired, which is hypertension and diabetes, through my family background.
Yes.
And so I knew that there would have been some challenges along the way. So
right.
There was always this propensity to try to look at things like exercise and that.
Right.
Of course, I wasn't always successful in maintaining.
You tried. you were not as good as you wanted to be.
But subsequent to having the surgeries,
yes,
I think I'm much more disciplined. Obviously, once you've been through those challenges,
yes,
you tend to look at making sure now that you are much more important in terms of these issues related.
You're now much more careful.
Yeah.
Much more committed, much more disciplined.
So before that, it was a bit of like a lot of pressure in your chest sometimes when I run a lot or over exercise.
Yes.
And I actually had a mild heart attack at work. And that's how I recognized that there were issues along those lines. So actually, if you ask me how I felt before, there were challenges in terms of breathing. Chest pains and stuff like that.
This was normal or only when you exerted yourself?
Yes, okay. Exercise and stuff like that. If you
and you knew something was wrong?
Well, yeah, suspected.
But something tells me you didn't take action right away.
No, really.
You're a man.
you always tend to think that you can overcome.
Everything's going to be all right.
If there's a problem, you can overcome it. It might not be as serious as you think it might be.
Right.
Even although there will be the challenges of the illnesses.
Yes.
So that I still, in my mind, thought that even when I had the pain, that this was just ear or something that was already the heart attack.
Yes.
You know? So then I had the heart attack, and that's when I had my first.
Did you know when you were having the heart attack?
Well, I obviously felt different because there was more severe pain.
Yes.
It was very tight in the chest.
Right.
And it was extremely painful, and it was going and coming. You sort of like drink something hot and you breathe a bit of air and you think that you're okay, and then it comes back again.
Oh, so all along you're having a heart attack, but you're thinking something else.
Yeah, I tried to put a positive spin on it.
Right. So how after that experience, I mean, at what point did you really seek medical attention?
Well, the same evening that I had the chest pains, I went to a general practitioner, and he's my normal general practitioner.
Yes.
I had had an ECG before that, which was a normal procedure whenever I go, and it showed up pretty normal.
Pretty normal.
Yeah. Even when I went the Friday with the heart attack, it did not show up too, because as it currently goes on, I don't think that you get all the information with the ECG. You need to take further steps. So he did ECG and didn't show up anything really, but he gave me some medication.
Right.
And asked me to come back 2 days after. And it was only when I came back, the 2 days after that, they recognized that I really did have the heart attack. When he went back over the procedure.
Right. So then he was able to tell you, hey fella, you had a heart attack.
He made preparations for me to go to the hospital.
Yes.
Which was the same Sunday.
Okay, so you've had some experiences. We'll talk some more. The time is 11 minutes after 9 o'clock. This is Living on Voice of Barbados, and today the doc is not in the studio, but a couple of his patients are here, and they're telling us about their experiences and so on. So we have a lot to share with them. I have a selection called Heartbeat, so it's definitely about the heart today. So stay with us, and we'll have some more to share with you. Oh, it's Catalyst Crew and Heartbeat. Well, we have the living crew here in the studio, and in the crew, David Drakes and Patricia Corbin, and I'm Maurice Norville. I am presenting Living today, enjoying it too, because we're talking about the heart and heart experiences. David Drakes and Patricia Corbin, they have had some heart experiences. Now, Patricia, you said earlier on that you found yourself in a situation where you needed to get some attention. You were in hospital, the QEH.
Yeah.
Okay. And what happened after the QEH? But first of all, do you remember who were the people, who was the doctor or who were the doctors looking after you in the QEH back then?
I can't remember.
Can't remember.
Okay. I think it was Dr. Massey. Yes.
Right. Okay. One of the heart people.
Yes.
Okay. One of the names we associate with heart and heart here in Barbados.
Right.
Okay. And you tell us about your experience at that stage in your treatment and so on.
Well, I was every now and then they would tell me to go on to get a different test, and the tests, yes, you were getting different levels of procedures,
right?
And things like that.
All associated with the heart.
Yes,
okay.
Blood tests, ECGs,
Were you frightened? Did you think you were going to die?
No.
At all?
No.
Oh.
No.
Why was that? The Lord, the Father.
Yes.
The Almighty.
Oh yeah.
Okay, you had your faith.
Yes.
Okay.
Yes.
Yes.
And the first procedure I had done was the angiogram.
Yes.
And then a couple of weeks after, I had the angioplasty done.
Right. At the QEH.
No, this was at Dr. Sparman.
Okay, so so ultimately you came out of QEH,
Yes.
and some
Sparman.
you went there, or somebody recommended that you go there.
My husband took me there.
Right. Okay.
Right.
Yes.
And,
He took you and left you.
Yes, he had to.
He took you and left you there in the capable hands
yes,
of Dr. Sparman and his helpers there. Yes. Okay. And what happened?
I went through the procedure, but the first thing that I noticed was that when they were doing the angiogram, even Dr. Sparman called the staff together.
Yes.
And we had a word of prayer.
Good. Okay.
And which boosts my
absolutely
faith
yes
more,
yes
know?
Yes.
And then he had it done, and by the evening I was back home.
Oh.
Yes. And then I had to come back the following day.
Yes.
For him to have a look at the incision.
Right.
And well, it was okay.
How were you feeling?
I was feeling good then.
Okay.
Yes. Still feeling good all it now. Anyhow, then the 2 weeks after, I had the angioplasty done.
Right.
And that was a similar thing.
Okay.
But they told me afterwards, because I had a burning in my chest.
Yes.
And I asked why was it burning.
Yes.
And they told me that they had to use the paddles on.
Paddles?
Yes.
What are the paddles?
Paddles to resuscitate me.
Oh, okay.
Which means that the heart had probably stopped.
Okay. If your heart stopped, you're dead.
It depends. It depends on how long.
Oh yes. Okay. But that must have been a special experience for you.
Well, I didn't know.
You didn't know.
Yes, I didn't know.
Okay.
You
Okay.
know?
But and since then, what has happened? Tell us about the treatment that you have had and so on.
Well, since then they've been monitoring. I go for regular ECGs.
How often?
And stress tests every 2-3 months.
At the Sparman Clinic?
Yes.
Every 2 months?
Sparman
okay.
Clinic.
And what?
I see it.
Go ahead.
Any little things that I feel uncomfortable with, I would call,
right,
and I would speak to one of the doctors there, and they usually keep me in good health.
If you had to live your life all over again, what would you do differently with regard to taking care of your heart?
Well, in my younger days,
yes,
well, I say a little older than teenager,
yes,
20s or so, I used to smoke.
Oh.
So funny enough, I felt that wasn't for me, and I stopped.
Smart.
But, yeah. And they told me that if I didn't do that,
yes,
it probably would have developed into a heart disease or something like it, you know.
I'm glad you stopped when you did,
yes,
because your condition could have been worse.
Yes.
Yeah.
and I had I used to play in netball, and
you were active.
Yes, yeah. Very active. Used to play cricket, netball, all sorts of things.
Okay. You still active?
Not
as much. Yeah.
I'm a bare spectator now. Because I don't see very well.
Okay.
Diabetes have taken over.
Okay. But taking into consideration the treatment you've had, the fact that it's been a heart condition and so on, are you afraid, would you say that you're afraid to get too excited over anything? Or does it matter?
Not anymore.
Okay.
And
you can live your life.
Yes. And since the angioplasty, 2 months ago, I had a pacemaker put in.
Okay.
So that has even made me more comfortable now.
You've had a nice journey with respect to the heart. Yes. And where do you think that journey is going to take you next?
Well, I don't know. I'm just waiting until the
Almighty
Father comes to me.
But you feel good?
Yes.
Okay. All right. David, again, you sit and you listen to Patricia, and you have a story yourself. You've had, but by the way, Patricia, at no time in your treatment did you have what we refer to as a bypass. You haven't mentioned bypass. Okay, you had bypass. Yes. You had triple bypass, David, and you had what was referred to as a mild heart attack.
Yeah.
Okay, and you've come under the care of a number of the heart people in the country. Tell us about it.
The first person was Dr. Massey, originally at the QH. Mm-hmm. Then, just like Patricia, I went through a number of tests, but then someone told me about Dr. Sparman, and I went over to Dr. Sparman. From the time I went in that environment, I felt really comfortable. It felt as though I was part of a family.
You felt at home?
Yeah, at home, part of a family. And it was a kind of positive environment.
Yes.
Then I had the angiogram, and then I had the test done. Because of the closeness of all the blockages to the main artery,
yes, Dr.
Sparman decided that it would much be better to go the route of the triple bypass. But he did all the preparatory work.
Yes.
Then after that, the last one was in 2011 when I had the angioplasty, which was probably a little bit more comfortable from the point of view of aftercare.
Yes.
Because the actual opening up of the heart with bypass is a very strenuous matter.
Yeah,
it takes some time for recuperation, but with angioplasty is much more opening up of the stent, the arteries through the stent.
Yes.
And it's much more, the rehabilitation process is much quicker. And that brings me to the point of saying that I believe that you need all types and varieties of treatment in a place like Barbados.
Right.
Especially bearing in mind our ideas of having tourists come here.
That's right.
Avoid across section.
Yeah, that's true.
It opens up you to other options.
That's right.
And I believe that in the case of Dr. Sparman, the angioplasty with the quick response and solid, getting better quickly, is another option which I feel that a place like Barbados need. But right across the board, you need all types of approaches to healthcare and heart patients. But I believe that I don't think you can do, in my view, one without the other in terms of providing the necessity for broad-based treatment.
Right.
So that I feel that the Sparman clinic is an asset in that regard.
Right. Yeah. I've no doubt about that.
I'm not saying that the others are not.
They all have their place.
Yes,
of course.
Like I said, I like both roads.
Yeah.
And I believe that I'm in a reasonable position to
absolutely, and people deserve to have choices.
Exactly. And I think that from that point of view, I feel that we need, that's in Barbados at this time, the level of right across the board treatment. And really the people, I just glanced through the paper only this morning, I was just really headings about specific issues with heart patients and the number of heart people problems in Barbados and the issues related to even the QH managing to be able to provide these services. It's really a challenge.
It is.
So that I believe that rather than any issues are related to which care is best, we need everybody on board.
Yeah, working together, cooperating,
collectively,
making sure that ultimately you and Patricia and Maurice are good.
Yes. Patience is the most important person.
Absolutely.
Right.
Yeah.
That's why you need choice.
That's right. Now look at me. I don't know. I would like to think my heart is good. Will remain good for another 100 years.
Yes, sir.
But Patricia used to smoke. What about you?
Never.
Never?
Never. The only thing I probably smoked was Barbados. Never really smoked. But my family background.
Yes. Yeah.
Both my parents were diabetics. Both of them were had hypertension.
Okay.
My brother's Rachel. He was the last person who attracted diabetes.
Okay. So what happened to you? It was in your genes.
Right. Hereditary.
Yeah.
And if I had to, I heard you ask a question about if I had to ask Patricia if she had to live all over there, what she would change. I believe that if I had to look at myself, it would have been much more emphasis on diet and exercise.
Yeah,
even although
eating well.
Terrorists, really recognize my family background. I tried to start a program, but right now I believe that it's more intensified since I had the illness.
Yes.
So that I would have jump started that before. But those are issues I feel that people need to look at, because you can look at you and still be suffering with that issues. So you need to look at exercise, diet, and stress, especially stress on the job.
You need to do the right thing.
Issues.
Yeah, the information is available. You need to listen. You need to take the advice and do the right thing, and not wait until it happens to you, and then you say, really, I shouldn't be doing this. That's right. You shouldn't be coming from behind. But most people. Most human beings just it's not going to happen to me. It's going to happen to everybody else.
Especially men have a problem with being preemptive in terms of healthcare.
Yes,
always like to lie against. I suppose they suffer from that percentage.
Right. What do you think is going to happen to you now from here on insofar as the rest of your life is concerned?
Well, I'm very dependent upon the grace of God. I'm thankful. And for my family support, my wife and all my family and my friends have been very supportive. But at the end of the day, it's still left up to me to really carry on the program and be positive in terms of being active.
Yes.
And looking at that.
That's right.
And also trying to manage stress effectively. But the environment, again, at this environment club has been very helpful, because we've got a support group there, and we work among ourselves.
Okay.
The environment staff is exceedingly gracious and very kind and very helpful. And I believe that basically once they keep sticking to the program in terms of healthcare, exercise, stress, etc. Okay. And the support of my family and friends, I think that I should.
You'll be around
with the help of the Lord.
That's right. That's the spirit. And Patricia, David talked about diet and food. The food part is very important.
Yes.
Am I allowed to continue to have a little bit of everything?
Yes.
That's all I ask. Can I still have a little ice cream from time to time?
Yes, and especially there's the diabetic ice cream.
Yes. Okay.
Although it's very sweet to me, I don't know.
But a little occasionally. I mean, last week when the doc was in here, he said to me, "It's okay if I'm a good boy for most of the month, at least once a month. If I decide to indulge in something like a couple scoops of ice cream, I should be okay.
And a glass of wine.
A glass of wine. Yes. Does it matter if it's red or white?
Red preferably.
Red preferably. Yes, I thought you would say red because I'm familiar with a lady. She is in her 80s now, possibly 90s, and she insists that she will continue to take her little glass of red wine because she says it is good for the heart.
Yes. It's good
for the heart. Yes. So we have been having a conversation today, and our sharing in this program, Living the Heart Experience, we intended for it to be good for your heart, listener, and we certainly hope that what we share today with David Drakes and Patricia Corbin will help you as you go forward. And if you ever find yourself having to seek help with respect to your heart, we know that you have your options, and we hope that we will continue to have the options and the choices here in Barbados. And we wish you well. You, David, you, Patricia.
Thank you.
All the best to you.
Thank you.
And I hope to see you. I hope to be around too to see you all continuing, with heart that is doing the job it's designed to do. Keep you living a good quality life.
Thank you.
Okay.
Thank you.